and welcome to Politics Today. I'm Farooq Patafi. Once again, we are going to talk about political situation of the country, but with a special emphasis on COVID-19. It is important because COVID-19 seemed to be receding from this country, but the positivity rate has come back to 7.46%. It is a staggering number. Of course, it is climbing up. If we thought that there was some magic involved in this virus disappearing from Pakistan, one thing seems clear. Weather seems to have played a very important role. When weather was hot, it seemed that the numbers started declining. And of course, there was a very well thought strategy at play as well. But now, once again, it seems when after months and months of lockdown fatigue, it seems that it is back and it is haunting all our places. Government of Pakistan finally decided, although one step remains, that schools are going to be shut from day after tomorrow, and they are going to remain closed till the next month, and after which the winter vacations will start. This is important, and of course, we have been talking about the importance of lockdowns, or at least voluntarily restraining the political jalsas and dharnas and rallies. But amazingly, it seems that not only PDM doesn't seem to actually restrain its people. We saw yesterday in Peshawar there was a humongous big crowd, and there was hardly any social distancing. There was hardly any mask that was visible among the audience. Of course, on the stage you can sit and wear whatever you want to. Of course, when you talk to them, the main argument that you get, and that is quite astounding, is that they keep on referring to certain other religious elements and their events, and they say that they were not restrained. Why are you trying to restrain us? The problem is that those religious elements might actually might be actually irrational actors, but these political parties have ruled the country. So we have to actually examine all these aspects as well, and there are two things that happened. One, of course, is Khadim Rizvi passed away last weekend, and that was astounding. And after that, we saw this mammoth rally during his janaza. And the second one, Mia Nawaz Sharif's mother also passed away. And now this gives birth to a question whether Mia Nawaz Sharif, who is former Prime Minister, but at this moment, in the eyes of law, who is an absconder, is he going to come back to the country or not? We are going to talk about all these matters and whether political parties can come up with some kind of resolution to ensure that common people, their supporter or any other party's supporters, they don't get exposed to coronavirus. We are going to talk about all these matters and more. In studio, I'm joined by Fareed Rais, a senior journalist, an anchor person also was there yesterday covering the event as well, and talked to many participants as well. Thank you very much, sir, for being part
Thank you,
of the
Farooq. Thank
program.
you. Thank you so much.
On Sky, we are joined by Ibrahim Khan Saab, who is MNA of Pakistan Tehreek-e-Insaf, regular on this show. Thank you very much, sir, for being part of the program. And Dr. Rana Jawad Azhar Saab, professor and expert of epidemiology, also joins us on Skype. Dr. Saab, thank you very much, sir, for being part of the program as well. Dr. Saab, let me start with you. I think we are trying to connect to him till the time he comes. Let me ask Ibrahim Khan Saab. Ibrahim Khan Saab, it seems that the government is very clear about its policy regarding schools. But when it comes to political agitation, political gatherings, and economic activities, we still are not that much sure. Can you explain why is it that despite all the restraints, PDM managed to hold a rally in Peshawar? And also, can you also talk about Khadim Rizvi's funeral? That was very well attended, sir.
Definitely, Ji. Unfortunately, since the whole world is going through this pandemic, and you're absolutely right in your intro when you said that since it was a start of summer, so I mean the threshold wasn't as did not have as big of an impact. And we thought like we have been the lucky ones and we have managed it better. Yes, we did a good management, and we were lucky too. Okay,
Yeah.
but now it has really come back with a very lethal strength. And back then it was like the maximum turnout of these infected people was not never crossed 3%, and now it's
Yeah.
up to 7 point some percent now.
Yeah.
So it is spreading, and we need to be, as a nation, we need to be very careful and need to follow the SOPs. And if anybody, I mean, regardless of any political background, I mean, if do not, observe the SOPs, is
Right.
going to, harm the people. I mean, you're putting people's life on the harm's way. And
Right.
I don't think anyone with the sane mind can for their can jeopardize the life of the people. I mean, just for their own political gains. I think that's really shameful.
Right.
And I think we all need to play a very responsible role. And
Okay.
now, when
So, sir, I'm glad that you are actually reiterating the values that are involved. But since your party is in government, when I come back to you, I'm going to ask you about what measures the government can take. But first, let me go to Fareed Rais. Fareed, you were there, and we have seen a lot of bluster, a lot of heavy rhetoric coming from the stage. But was there any understanding among the political leaders gathered there that they are exposing their followers to coronavirus?
Actually, they are not willing to understand this situation.
They're not willing to understand.
Yes, they are
That's
not.
you realize that is quite a loaded statement. Okay.
They are not willing to
Okay.
understand about the pandemic and the rising COVID-19 cases, active cases, as you mentioned in your intro,
Yeah.
that the percentage of the COVID-19 cases are rising in Pakistan. It is really very alarming.
Yeah.
And the first wave, it was not so lethal, but in the second wave, it seems to be more lethal than before.
Yeah.
So now in this situation, when the political parties and the PDM and these parties which are now willing to send, according to them, they are not they do not want this government to continue more, and for that they are having this PDM, the platform. And after the Gilgit Baltistan elections, we saw that in the elections they all ran different campaigns, they all ran
Yeah.
massive campaigns. And after this, when the government on 20th of November, the deputy commissioner issued a notification on which on 5th of November 2020,
Yeah.
these parties requested for the NOC for this rally, for the Jalsa.
Even, yeah.
But on 20th of November, the Peshawar district deputy commissioner Peshawar refused for
Yeah.
the Jalsa, because due to the rise in the COVID cases. And as we all know that the minister Asad Umar also tweeted that in Peshawar the COVID cases are rising, and around more than 13%
Yeah.
of the cases are rising. So the PDM party should avoid this Jalsa. But on the other point of view, I talked to many of them that why you are exposing the people over here
Yeah.
when the COVID cases are rising, the government is alarming you.
Yeah.
And the first wave, all the political parties and the PDM, the opposition, they criticize the government, that the government is not taking it seriously. And as part of the opposition parties, they quit all the political activities when
The government, they said that the government is not going to
Yeah.
stop whatever it is doing,
Yeah,
but
yeah.
they ask us to stop.
yeah, but now
And I'm going to actually talk about this in detail
Yeah.
because you started with a loaded statement. Let me bring in let me bring in the third guest who joins us via Skype, Dr. Rana Jawad Asghar Saab. Thank you very much, sir, for being part of the program. Dr. Saab, there is a lot to unpack here, and I want your help. I want to understand because on one side we keep on hearing about the possibility of a vaccine. On the other side, we are also witnessing the cases of reinfection. So the entire idea of a herd immunity seems to go out of the window regardless whether there is a vaccine or not. Do you think that there is any hope at this moment for all of us, or whatever we are doing, social distancing and all these mask wearing is going to be the new normal till the time we know?
Thank you very much for inviting me.
So,
And actually, until we get vaccine, that's the only hope we have, is that we ensure that everyone is wearing a mask and keeping the social distance and all the public health precautions which we are telling from the start of this pandemic. The good news is that today the third vaccine, very encouraging results of third vaccine have been announced. And so now the situation is much brighter, that hopefully in coming months, there will be multiple producers of effective vaccines around the world, and the availability will be easier than what we were hoping, what we were not, what we were
what
fearing,
we were
that
fearing.
it may be
Right.
constraint on the supply chain. But
Right, sir.
the important part is
Regarding
your question of
the
really passion.
situation at this moment, let me ask you about something that might not be political, but I want to understand. The expertise is there. Kind, good people like your good self are there. But it seems that we haven't, as a nation, been able to understand why it is important to social distance, why it is important to wear masks. When you go into the public, you realize that hardly anybody is following those SOPs. Why is it that there is a lacuna in the messaging, sir?
So, for any pandemic, a very important, what you call the sister strategy, is about the risk communication. Unfortunately, risk communication as a strategy has not been used fully in our context. Government issuing SOPs and guidelines, which may be scientifically accurate, does not replace the required need of a proper risk communication in emergency situations. Because your second part of your question is that why people are not following it. And there are certain ways in which you bring them on board while you are making those decisions, the public on board, at different communities on board, once you are making those decisions. And even until now, we haven't done that. So even though our guidelines are, perfect, but the public who has to apply on themselves have not been, they have not been part of the ownership process. And this is a simple thing to say, but this is the critical thing which is missing. And the people like us who work on pandemics or epidemics, for us, alongside epidemiology of a pandemic, risk communication strategy is also critically important. And the
Right.
reason why people are not
Yeah.
following is that,
Yeah.
one, we didn't have risk communication strategy. Two, people got mixed messages. Different political
Right.
parties, as you
Yeah.
said in the beginning, were saying something different, and now the roles have been changed. But the problem is, if you are from a general public who is not very educated, they are getting confused that what was right and what is wrong. So that's
Okay.
why it's very critically. The other thing which is important is, for this pandemic, and the winter is coming, that all the political parties, and not just the political parties, I would say the whole state of Pakistan, should
Right.
make an agreement on how to manage coronavirus pandemic.
Right.
And
Dr.
that's
Saab,
like
this is a very
national
good point.
emergency we
And let
have
me bring in
faced.
the government's representative here as well, so that we have some appreciation of bigger picture from their side too. Ibrahim Khan Saab, you are listening to what Dr. Saab is
Sure.
saying. The matter
Right.
seems to be very clear, right? And one has to actually find solution. We keep on saying that there is going to be effects of coronavirus. We are talking about the possibility of economic downturn. But right now it seems that coronavirus on its own is an existential threat to the entire society. Why is it that the government, when it comes to talking to the opposition, it keeps on appealing rather than enforcing the law or your own SOPs? B, if you cannot do that, we saw what happened at Khadim Rizvi's place. But the second thing is, then at least have a broad-based dialogue with the opposition so that we can take care of this problem?
I think for any person with the sanity sh- should realize and does realize the importance of the SOPs and the way this corona, I mean, COVID-19 has proven to be lethal. I mean, for anyone, I mean, it should be. I mean, look at the Zardaris now. He's going to engage his daughter to somebody, and they're following all the protocols that you have to have a certificate of clearance from
Yeah,
the PCR done, and unless you have that, you won't be able to attend the wedding. At the same time, they are luring people in to come to their jalsas and their processions or congregations or whatever, and they are least bothered that if people are in the harm's way. It
right,
shows, it reflects the mindset of these 11 family-owned parties, that they
right.
have no concern or no really have any passion for the people of Pakistan. They're
Right.
all there to grab their own positions and consolidate their own powers.
Right.
This is what all they are
Ibrahim
all
Khan Sahab,
about is.
I hope that after this you have gotten this out of the system. But let me remind you that you are at this moment in the driving seat, right? They might be bad, they might be
Absolutely.
evil, but you have to actually find a solution that actually affects your own constituents, the people of Pakistan. So,
Okay.
what exactly is the strategy you are going to go with? Of course, you can tell us how bad Asif Ali Zardari, Mian Nawaz Sharif, or others are. By the way, you said
Sure.
11 family-owned parties. Now the 12th is also a family-owned party. TLP has become a family-owned party as well. The way we saw
Exactly.
succession. But the
Right.
question that I am asking you right now is what exactly is the policy intervention? We have seen NCOC working,
Policy
but
intervention, you have
political side
just
has to
today.
do something as well.
Absolutely. We are taking all the precautions, and our, Asad Umar is heading the whole system dealing with this pandemic issue.
Yeah.
And just today, we have announced shutting down of all the schools and colleges. So
Right.
to as a preventive measure. On top of that, we are, through our district governments, we are putting efforts and letting people know, like, for God's sakes, use precautionary measures and follow the SOPs and try to save your own life. And you have, the other question you said was, where is the government? If people don't follow, then the
Right.
enforce it. And
Yeah.
that's where my personal view is that we should talk to them, make them understand, like, this is not the time to play politics.
Okay.
It's an issue of survival of the people. And for God's sakes, you should, you see, we
Right.
did the same
So,
way when, if you're, I'm just giving you an example that
right.
when we were holding a dharna, and there was this incident that took place in Peshawar where that terrorist killed all kids.
Yeah.
Imran Khan called off the dharna. He says, no, it's
Yeah.
a national issue or issue of a national importance, that
Right.
I call it off, and
That's a
we'll
good
keep
example,
our.
sir. Let me go
Right.
back to Fareed Rais here in the studio. Allow me to include him as well. Fareed, you have listened to our participants. The question, I can talk about political parties, their reaction, whether they have a solution or not. But let me ask you another very important thing. There's a role of social media and media in redistributing the foreign conspiracy theories. I mean, I saw Elon Musk sharing a video of pressure of two doctors, right, in California. Immediately, it went viral in this country. And our anchors and journalists were talking about this and actually endorsing the message. If you have such a irresponsible media, how do you actually hope that things are going to be, they are going to get better?
It's a very valid point raised by you. And in this pandemic, we are also living in infodemic.
Yeah.
we are also facing the flow of the information, or you must say the info from all around us.
You're calling it infodemic.
Info-
Can we call it anchordemic? Because mostly anchors are doing it, right?
actually
Pundits.
most of the time the anchors and the journalists or the media, they are following the trends, actually, which is the trending on social media, which is trending on the Facebook, on
Okay.
Twitter, on Instagram, and all those things. And we actually we go back to these things, and we think that if the thing is coming from a social media platform and it is being discussed, it's gone viral, then we should discuss it without having any kind of we can clarify the things, we can just verify the things. But you are very right that the flow of information is too much in this situation, and it's sure that definitely the people are having, in the first wave we saw many remedies coming from this social media.
Totecast, right?
Yeah, the totecast and all those things. So the basic thing is to verify the things, to get the things understood. I have talked to many people. I usually visit for my programs or all the things to the masses, and I talk to them. Usually, basically, the people are not willing to understand, and they are not accepting it that there is something named COVID-19.
Right.
And
Farid, you are very smart, and I see how smartly you have sidestepped the responsibility of media itself. I mean, we can go on talking about how the government should have these messaging boards and how it should be actually ensuring its communication strategy. But with due respect, when an anchor sits on television, it is not his own airtime. He has not bought it. He is serving the people, right? People are paying for it by watching it. Do you think that media has to actually look into the mirror and realize that they are contributing to the destabilization and poverty and health problems of the people?
as far as the awareness is concerned, I was just listening to Dr. Saab and other guests. They are saying about the awareness also. I think so that all the media houses have also played their role in creating an awareness to the people that
How?
they are displaying the public service messages. I've seen myself that there are numerous public services messages regarding the COVID-19 that you should avoid, you should make some social distance, you should wash your hands,
you're talking
you should
about
wear
ads.
mask.
You're talking about ads.
Ad is something different, and
Promotional messages,
and public
right?
service messaging is
Okay,
something different.
Right. A slot where you have a pre-packaged message, right? And then in between, an anchor comes and sits on television telling people that all these things are wrong.
It can be few of them, but I don't think so. It's all of them. Yeah, I must say this thing. I usually don't do
You
this thing
don't
that-
do it,
so
I don't do it,
Yeah,
but responsibility of the entire media, the same owners who employ
it
these
is the
anchors.
responsibility. Yeah, I understand. I accept this thing that it is the responsibility, but there lies individual responsibility also. If you are sitting over here and you are doing a show, you must realize your individual responsibility. Yes, I do. I agree that there are certain responsibilities, certain policies, some rules that you have to abide by.
Going back to what you were saying regarding opposition, right? You said that they don't want to,
They're not willing to.
They are not willing to.
Yeah.
Okay, your
Yeah,
words.
they're not willing
Exact,
to.
Verbatim. Let me ask you, then why were they wearing masks while sitting on the stage?
Yeah, but actually they have some heavy responsibility on their shoulders. Actually, they are the big figures, and if these leadership of these people don't wear the mask, they will be criticized. But yes, but as I've witnessed, many people, there was no social distancing at all.
On the stage or in
no,
the people?
on among the masses also, and on the stage they tried to maintain some kind of a social distance, but not completely. There was not a complete social distance on the stage also. But I was on the stage and I was watching across the area, across the place where the
People were not doing it at all.
Again, it's obvious
You're
that
right.
there was no social distancing at all. Not among the people, those who were gathered or those who were present in that jalsa, but also the common man. I don't see the place. I visited Peshawar. There were not people who were
My
wearing
concern
masks.
is we keep on asking government to implement SOPs per force.
Yeah.
When the government will do it, we media people will make a martyr of the same opposition, which is actually trying to challenge the health care of so many people. Let me go back to Dr. Rana Jawad. Dr. Saab, since we are talking about these matters, you can talk about anything that is discussed But let me also ask you a technical question regarding positivity rate versus mortality rate. The impression right now all over the world is that while positivity rate keeps increasing, mortality is not that much so high. Do you endorse this idea or do you think it is wrong?
I think what we are calling it alongside infodemic, which your guest has rightly mentioned, which is a major risk in this pandemic. The other major risk is what we called armchair epidemiologist, and people are trying to
Yeah,
interpret the terms
yeah,
without understanding the full depth of it. So case positivity rate is an important indicator, but once people target that indicator, then we saw it behaving differently and not logically. And I wrote a couple of articles on that. Overall, globally, because the availability of tests was available and also the pandemic progressed over these months, we are seeing higher number of cases across the globe. In hospitalized patients, we have also seen 30% decline in deaths. So that means that if someone was infected and had severe complications which needed hospitalization at the start of pandemic, has now 30% less chance of dying because of COVID-19. That's a major improvement. But
right.
I also need to remind people that total number or denominators are important. For example, if there were 10 people getting sick earlier and there were, let's say, the fatality rate was 10 and 10 people were dying. Now we may have half that risk and it may be 5 people out of 10, 100 may be dying. But if your total number has gone from 100 to 1000 or 2000 or 10,000, you will similarly, even though with low case fatality rate or low mortality, you will have much higher number of total deaths. So you need to look at a bigger picture and see what makes sense and what doesn't make sense.
Right.
Important thing,
Right.
I'm
And
coming back to because
regarding
you
this
have guests from the
fertility rate
media.
decline that you were pointing out, may I ask you what might be the factors that playing into it? Because we kept on seeing the talk of super bugs that keep on adapting to new medicines and environment, and maybe they will be more fatal when it comes to taking lives of people.
So the two number we are here talking about, one is what we call the case fatality rate, that out of all those who got infected, how many died. And if you remember, Pakistan has this CFR, what we abbreviated as CFR or case fatality rate, or simply for general public, let's call it death due to
Yeah.
percentage of death due to coronavirus. That has been 2% in Pakistan. In other countries, there are different rates, but over these months, they have also improved. And one reason is that because more milder cases were being detected later because availability of test and testing
Okay.
facilities. Because when any outbreak starts, it's only the most severe cases which are picked. But once you have available diagnostic test, that means you are finding out asymptomatic cases, and but the deaths rates pretty much stays the same, and overall you get the fewer numbers or fewer percentage. That's one
Okay.
thing. The other
Right.
thing which I mentioned earlier was the deaths due to in hospitalized patients. That means the
Right.
people who had severe complication. That has also seen reduction in across the countries, and what we believe is because of the improvement in treatment protocols. Because when
Right.
a disease comes new, doctors are not trained to treat it properly. But once the time passes and they have seen and treated so many of those patients, they developed good protocols, and they're like the whole health systems now knows which medicine will work at what level, and so that's the main reason is that we have reduced the death. But the virus is mutating, and
Okay.
it has mutated a lot, but still
Right.
the good thing is it has not become more dangerous or more lethal. Some
Right.
people feel it has become more infectious. It's
Right.
easy spreadable, but this is debatable. But it has not become more deadly at this moment.
Right. Let me go back to Ibrahim Hansab, sir, since we are talking about all these matters remember that I'm asking the same question third time, but in a different fashion. Let me ask you, what are the levers that might be available with the government to ensure the compliance in all these regions that fall under the government's purview? If I am not going to cooperate, are you going to penalize me or not? If you are not going to do it, how does that work? Where is the responsibility? If you are going to do it, then of course you know how media is going to play it. Then what exactly is your contingency planning, sir?
Well, first of all, for the general public, I mean, the
Everyone's.
matter has been exactly. I'm
Yeah.
saying it is like you'll be fined 500 rupees per person if you are not wearing the mask. And if you are found in violation of the SOPs, this is the sort of, general on every district level. This is the, the criteria which has been fixed. And still, implementation phase is still yet to be seen, like to what extent it is implemented or not. But this was for the general public. As far as you see, this is one person who is being careless and not being able to take care or follow the SOPs is one thing. On the other hand, knowingly the level of its lethal, what you call is impact
Yeah.
uh, on the people, and in spite of knowing that, you still gather people and go in violation of the government orders.
Okay.
My personal view is that these people, whoever they are, whatever position they hold in the society, they should be simply apprehended
Okay.
and put behind the bars. Otherwise, there
Right.
is no other
And to do
alternative to
that,
that.
let me ask you another hypothetical, sir. For
Sure.
example, God forbid, I have COVID 19, and if I sneeze at somebody deliberately to spread the virus, is there any law that you have written to ensure that I'm punished? You are a lawmaker, right, sir? So, if you haven't
I
written that kind of laws, how are you going to actually implement the SOPs then?
Okay. Since you have asked me a hypothetical question,
Yeah.
anyone with the right mind or who has even the lowest of the low IQ will never put anyone else's life in jeopardy by knowing that you have some certain type of this COVID-19 sort of a disease which can infect the other person and can be lethal. Maybe it might not be lethal for me, but it can be lethal for the other person. And I
Okay.
intentionally go is that is an attempt to murder another person in other way,
Right.
in other
Right.
words. So
Right.
I think it is a hypothetical is fine, but from if you take it from some sort of religious point of view or ethical point of view, I don't
Right.
think people would be that sick
Now,
to
sir,
go
you
and
have actually
adopt this
raised
kind of.
another very important point. You just pointed out the efficacy of religious scholars as well. Maybe you could
Sure.
have used that route and actually reach the people through the power of pulpit and bully pulpit, actually. But it seems that there too, I mean, Khadam Rizvi's funeral is before you, other religious events are before you. Even there in congregation, last time you were trying to actually shut down the country, at that time, religious elite actually refused to, ensure social distancing in the mosques. So that also happens. Why is it that you haven't been able to come up with a coherent message that would convey it to the people? You have to ensure social distancing. It is for your own good.
Sir, we and even the whole society, even if you were to call someone on his cell phone, the message before that call rings, the message starts saying, okay, the COVID has come back, it is more lethal, be careful, adopt these all SOPs and take care of things like. The social media part is, I mean, they are doing their part of the responsibility. Every Pakistani is who has a knowledge about this COVID-19 is taking it very seriously. Now, some political leaders or some religious leaders, whoever is now violating these SOPs, in my personal opinion, they should be held accountable according to the law. And
Right.
but no one should be allowed to jeopardize anyone else's life.
Right, Ibrahim Khan Sahab, you are very generous with the generalizations. You said that nobody sane would ever think about infecting other people. You also said that conscientious people are actually following the bylaws. With due respect, sir, this country has endured terrorism for 20 years, and we have seen there were quite sane, visibly sane people who blew themselves up to kill other people as well. Let me go back to Fareed Rais. The problem, I mean, my problem is that if somebody is failing to communicate or educate the common masses, the problem lies with our inability to provide even healthcare to everybody, right? The world's biggest democracy is struggling with the idea of healthcare. In this country, of course, we don't have that kind of resources to ensure people have that kind of treatment. In that situation, it actually is very unkind and it is very evil if we are misguiding people that COVID doesn't exist or maybe it doesn't spread or no matter what you do, this thing cannot stop it. There lies the problem, and nobody is realizing. Why is it that PBA, Pakistan Broadcasters Association, CPNE, APNS, the paper, newspaper owners, why haven't they come together to come up with some kind of SOPs for their own messaging?
Yeah, very rightly said, Farooq. Just allow me to comment one thing. As
Yeah, please go ahead.
PTI, honorable guest was saying that thing. I feel that we have the laws. We have all the laws implemented.
What laws?
We have that, but the basic
No,
thing is
regarding this issue.
you talked about that hypothetical kind of a thing that if someone goes and deliberately sneezes infect somebody else, someone else's. So I think that we have the thing. The basic thing is that we need the will to implement and to make sure that if we have imposed a fine of rupees 100 or rupees 500, that fine should be in letter and spirit.
Yeah.
That should be that should exist. It should not be only in theory. It should be in practical. We have witnessed the countries, the developed countries. I can give you the examples. You must also have the examples of many countries. We can take an example of in Italy, for example. There the government they find the people if they were seen without mask. They provided free masks to the people. They provided the education. They provided awareness, and they imposed whatever they can do to avoid this pandemic, because it's not a joke. We must realize that it's not a joke.
Yeah.
As far as the point and the question you asked about that
Media owners.
the media owners and the CPNE and the PB and all those things, I think though they have done, but in my opinion there is a lot to be done more.
No, but here's the problem. I have seen umpteen notifications coming from PEMRA about decency or indecency. Why is it that I don't see any notification coming from PEMRA, PT or anybody else regarding these messages about healthcare of people?
The healthcare of the people, the basic responsibility lies upon the shoulders of the government. The government is basic responsible for providing the
but I'm
healthcare
talking
facility. And
You realize what I'm doing?
Yes.
I'm talking about the state
Yes.
and the society.
Exactly.
And I feel that we all, I mean, NCOC is doing an incredible job, doctors are doing a great job. But you and I, and politicians also, and intellectuals, and whosoever it is, they are failing the common people of Pakistan.
This is because we lack communication. We do not communicate with each other. We have trust deficit. We don't communicate with each other. We don't have the cohesion.
We lack conviction and empathy. Let me, for the one last time, go to Dr. Rana Jawad. Dr. Saab, there are two aspects that I want you to help us understand. One, data regarding infections. Have we been able to view that in terms of class, upper class, lower class, middle class? And can you tell us where does the bulge lie? And regarding herd immunity also, because when we have heard that reinfections are taking place, that would actually mean that long-term herd immunity cannot take. Do you agree with this proposition or not? Both the answers, sir. Please go ahead.
Yes, let's first start with the first question of about the data quality. Unfortunately, the data in Pakistan is very poor in quality. It's both. It has both problems. People who are collecting it are not collecting it properly the way it should be collected, and the two, in some areas or some places, it's let's say it is also being managed. And so both problems. One is the data which is coming is not properly collected, and two, there is huge underreporting knowingly and sometimes unknowingly. That's one part. But the data which came from outside of the world, we know that it especially affects the poor populations and the people like in US. It target mostly the minorities, which were the poorer
Right.
part of the society. On
Yeah.
your second part of the herd immunity, I think now there is a consensus of nearly 100%, or let's say 99% public health experts around the world, that globally, the people who have been infected by now, even in the worst areas where it devastated communities, it was never above 18, 19%. For the Pakistan, people have, like scientists have estimated, like at national level, we are still around 6% people of Pakistan have been infected. So, and herd immunity is minimum required 70%. So
70 to
thinking about
75.
that, we
Yeah.
will acquire herd immunity. That means you have to be okay with much more deaths, which
Right.
will take place if you just follow that strategy.
Right.
And most
Dr.
now
Saab,
public health experts
there is
consider
one herd
as a
immunity with vaccines help as well, right? So does that
so
work?
that's the second part.
Yeah.
Yes. So once the vaccine comes, that's a different story. For with vaccines, this is a safest route, and but without going to that herd immunity without vaccine is considered criminal. There about the reinfection,
All right.
this is expected. What I've been told by some senior doctors in Karachi that they have seen around 10, 12 documented cases of reinfection in
All
Karachi.
right.
There has been other also reported, I think one or two cases more. So around dozen
Right.
cases we know at this time in Pakistan, but again, globally there is only handful of documented cases of reinfection. But
Right.
as the time passes, because we are just 8, 9 months in this outbreak, so we need to give it time to figure that out, that how long the
Right.
immunity of the virus itself or the
Right.
vaccine will last long. But even if it gives
Right.
for the vaccine the one
That's
year
an important point, Dr. Saab. I'm told that we have run out of time. Dr. Rana Jawad Asghar Saab, thank you very much, sir, for being part of the program. Ibrahim Khan Saab, thank you very much for being part of the program as well. For Eid Reis, thank you very much
Thank you,
for
sir.
participating and actually coming to the
Thank you.
studio.
Thank you.
Viewers, you have listened to our participants. Of course, what happens in the political arena is something that you and I can actually ask politicians to moderate or modulate for that matter. But here's something that Dr. Saab was just saying, and you have to look at it. One aspect is the virus is very new. So we still are struggling with a lot of behavioral aspects of the virus, and it will take some time to do it. But here's the thing, we might know the virus, but we know our own people. When it comes to data generation in the country, at least we should have the formats which are needed to parse the data and to ensure that we have a coherent theory of what is happening, who is being affected, and how to actually take care of these matters. Let us hope in coming days we see a solution in this regard also. Let us hope our politicians, our media, our intellectuals, our policy makers and other segments of the society also take a serious notice of this affliction that affects the poor of the country more. Let us hope in coming days that stops and the country starts healing. This was today's program. Thank you very much for watching. Take care.